The state is preparing for every emergency imaginable. News 12's Virginia Huey has the story.
This is yet another act of violence upon an American city.
The deadly shooting at a Tulsa, Oklahoma hospital has put the spotlight on the safety of hospital patients and employees across the nation, including Long Island.
Here at Northwell, we drill constantly.
Scott Strauss, who heads corporate security for Northwell Health, says he spends every day preparing for this issue.
I don't know what's going to happen tomorrow, but I can honestly say that we're doing everything we possibly can to prevent it and to mitigate it as quickly as possible.
At every one of Northwell's 23 hospitals, visitors must present government-issued ID, which is checked against a patient database. Visitor ID cards are required to gain entry through turnstiles. Armed guards are posted in the lobby and throughout the hospital.
All of them are current or former law enforcement personnel. They go through intense amount of training, just not what the state requires.
Strauss says all hospital workers play a role in helping the security team. They are trained in how to identify patients or visitors who may consider doing harm to others and how to report those people to security.
We do, in every single room or office, we have like a panic button, so if something were to happen, we could press that panic button and they respond immediately.
Northwell Health CEO Michael Dowling says while his team is doing all it can to keep hospitals safe, it's critical for Congress to pass legislation that will have a real impact on the scourge of gun violence.
You should definitely be having universal background checks. Why not? Why not get rid of assault weapons? Who in their right mind needs to buy an assault weapon?
Meantime, Strauss says Northwell is looking into installing metal detectors as another layer of protection.
They're going to get world-class health care here. We want to provide them with world-class security.
Virginia Huey, News 12, Long Island.
In the past week, several healthcare organizations, including National Nurses United and the American Medical Association, have made the push for action on gun violence.